Hello, and welcome to the PAHO podcast, Turning the Tide, NCDs, Mental Health, and the Urgency of the United Nations High-Level Meeting. This is our space where we have a conversation with experts on NCDs and mental health and unpack these most pressing health challenges. I'm your host, Silvana Luciani, from the Pan American Health Organization's NCD program. And I'm really excited to bring to all of you all the work that we're doing at PAHO with governments, civil society, academia, and the public to prevent NCDs, to promote mental health, and to improve the health system response for better care for NCDs and mental health. And today we're discussing the fourth high-level meeting of the United Nations General Assembly on NCD Prevention, Control, and Mental Health Promotion, also known as the UNHLM. And to understand what this UN meeting is all about and why this matters, we have with us today Dr. Anselm Hennis, Director of the Department of Noncommunicable Diseases and Mental Health at the Pan American Health Organization, who's going to talk to us. Welcome, Dr. Hennis, and thank you for being here today on this podcast.
Yes, thanks so much for having me. It's an honor to be part of this conversation.
Wonderful. So let's just get started with some of the basics about non-communicable diseases, because we know that cardiovascular disease, cancer, diabetes, chronic respiratory diseases, these are the leading causes of death in all countries around the world. And this is the fourth time this year, since 2011, that the United Nations General Assembly will hold a meeting to deliberate on what can be done globally about non-communicable diseases. So what can you tell our listeners about why NCDs are a problem, especially in the Americas region, and what can be done about them?
Yes, well, thank you so much. Well, basically, non-communicable diseases. These are in contrast to diseases which are infectious that is spread from person to person, for example, like the flu or the common cold. So these diseases are not spread in that way, but they're in fact the most common diseases that affect us, particularly as we get older. And these include cardiovascular diseases, hypertension, strokes, cardiac heart disease, cancers, diabetes, chronic respiratory disorders, and these are diseases like asthma and chronic obstructive airway disease that occurs in long-term smokers. In 2021, these conditions caused around 6 million deaths in the region of the Americas. That's about 65% of all deaths in the region. And what is even more alarming is about 2.3 million of these deaths occurred in people between ages 30 and 70. These are so-called premature deaths. And in fact, many are preventable. And in fact, even while we speak about deaths, you have to think about the huge burden of suffering that people with non-communicable diseases have. So we know, for example, that in the region of the Americas, which has about 1 billion people, roughly 240 million people have at least one non-communicable disease. So these are, by and large, the most significant cause of ill health, disability, suffering, and premature death in the region of the Americas. And the other issue, which is also relevant, is the fact that the demographic changes. The region is rapidly aging, the most rapidly aging region of all the 6 major regions. So that also adds to the complexity of the problems.
Yeah, these are really important points that you raised, Dr. Hennis. NCDs are a growing problem, largely driven by the aging population because these diseases are more common as we get older. And they're also largely driven by those changes in lifestyle. But what drives those changes in lifestyle is what's available in our environment, like the unhealthy foods, the ultra-processed foods, the sedentary lifestyle that we're all driven to because of social media and all those environmental factors. So we know that a large proportion of NCDs can be prevented by improving our environment and by enacting policies that promote healthy lifestyles. And no doubt, Dr. Hennis, that the political declaration of the United Nations High-Level Meeting on NCDs and Mental Health will call for bold, accelerated, multi-sector actions to help promote some of these policies that can promote health and help reduce all the risk factors that contribute to NCDs and prevent NCDs. So what do you think will happen at the UN high-level meeting? And how can governments prioritize some of the actions?
Well, you hit the nail on the head. And many of these things can be prevented and controlled by policies. And there are a number of key strategies that have been proven to work. For example, a whole of government approach. This really requires political leadership. Once there's political leadership in terms of diseases or health conditions, that is one of the greatest catalysts for strategies to prevent and control. So in other words, this means bringing together education, agriculture, transport, finance sectors, among others, that support environments that support health choices. So in other words, if in a country, the Ministry of Finance decides that growing tobacco is great, it brings lots of money to the economy, but by the same token, the higher production of tobacco results in people smoking a lot more, then it has an adverse outcome in terms of the health of the country, and then the economy ultimately suffers. So there must be policy coherence, which is aimed in the direction of a strategic approach towards better health for all. And so this means a whole of government approach with strong political leadership, so the right things are done. Then another major pillar is strengthening primary health care. And so this is non-communicable disease prevention by tackling risk factors, strengthening the delivery of care at a primary health care level, where prevention, early detection, treatment, control, prevention of disabilities, referral, if people are no longer controlled at primary health care, to the secondary care levels and to the specialists with referral and counter referrals. And then, of course, primary health care is the place where people are treated, which is nearest to their communities, which helps to support access and also engages the entire community and family members in terms of care. Another issue is the use of fiscal policies. What I mean by fiscal policies, if one, for example, reduces the consumption of those factors or products that are detrimental to health through, for example, taxes on tobacco, taxes on alcohol, and taxes on sugary beverages, this immediately reduces their consumption. But the added benefit, it also generates funds, which can also be targeted towards public health. And there are many situations of win-win-win where these strategies are involved. It also helps to improve health, and also it helps the economy of the countries where these are implemented. And in fact, now at the WHO level, there's a 3x35 strategy, which is looking at taxing tobacco, alcohol, and sugar-sweetened beverages by 2035. Then another element is you need to be able to monitor what you're doing, which means expanding surveillance systems so that you can track NCD trends, tailor interventions, and also report on how people are actually benefiting from the interventions. So if there's need for course corruption, that's also built into the system. Then one really key element is addressing inequalities. So what we know is that populations which are living in vulnerable conditions or situations suffer the most from NCDs. So those persons in the lowest quintile or the lowest fifth of the income bands of a country tend to have far higher rates of NCDs and risk factor behaviors. And that really is that those who have little end up eating more junk food, they tend to smoke more, etc. So really, there must be social protection measures and addressing inequalities by making sure those who are most vulnerable have access to care and preventive measures as well.
Wonderful. Thank you. Thank you, Dr. Hennis, for summarizing the interventions that are necessary to reduce the burden of NCDs, namely strengthening primary health care to offer treatment to those living with an NCD, and enacting health policies to reduce risk factors. And I especially like how you've highlighted health taxes, because health taxes can reduce consumption of unhealthy products while generating funds for governments to invest back into NCD programs. So you've noted that the relevance of this UN high-level meeting is really around creating more political leadership and having more of a whole of government, whole of society approach to address NCDs. So can you tell us a little bit about how PAHO is supporting all of these efforts around NCD interventions and creating more political support and multi-sector actions on NCDs?
PAHO is actively involved in the preparatory process for the high-level meeting on NCDs and is coordinating with the global activities led by the WHO headquarters. So in 2024, we held virtual meetings with the national NCD program managers to review progress in the countries towards achieving the NCD targets. We held another regional meeting in March of this year with national NCD program managers to discuss how to accelerate progress towards the targets. We've also had discussions with the countries themselves and civil society about what they would like to see done and what the other priorities they wish to bring to the table as part of the political declaration of the high-level meeting. And we also have ongoing technical discussions with the countries. So this is very much our work, informing, disseminating, sharing information about the so-called best buys. These are cost-effective strategies, which we discussed here as reducing alcohol, tobacco, sugar-sweetened beverages, and junk food, etc. And we've been disseminating information in terms of how these strategies impact in a positive direction. So we also have a regional call for best practices in NCDs. And this is allowing countries to share their experiences so we can create a collection of successful NCD interventions according to PAHO best practice standards.
Excellent, excellent. And I understand that the best practices and this compilation of experiences across the whole region on NCD prevention, NCD management, and on NCD surveillance, there's a collation of stories that are available on the PAHO website. So I'd like to encourage all of our listeners to view the PAHO NCD webpage on best practices to learn more about that. Thank you for highlighting that, Dr. Hennis.
For sure, it's a pleasure. And also, as you know, PAHO has been at the forefront of this space for over 25 years. We've been helping countries to develop national NCD policies and multi-sector action plans, implement primary care interventions, and widely known as the HEARTS program for hypertension control in the region of the Americas, also helping countries to strengthen NCD surveillance and regulation, and also drive progress towards the 2030 Agenda for Sustainable Development.
Excellent, excellent. And so we know that at the UN high-level meeting on NCDs and mental health, like typical UN high-level meetings, it will end in having a political declaration. So is there anything you can tell our listeners about the details of what is expected to be in that political declaration that will be highlighted?
Yes, so we've been working on what is called a zero draft declaration. This is after lots of consultations with countries and civil society and other stakeholders. And so the zero draft declaration calls for immediate commitments from countries, and these include 150 million people less using tobacco, 150 million more people with hypertension under control, and 150 million more people with access to mental health care. Now, we didn't specifically talk about mental health care, but it is also considered one of the non-communicable diseases. And of course, there's a large burden of ill health and disability linked to mental health conditions. So our recipe to be able to accomplish this is to prioritize 5 areas or commitments. So in other words, creating health promoting environments, strengthening primary health care, increasing sustainable financing, strengthening national governance, strengthening data and surveillance to monitor the progress and to facilitate accountability. And the resolutions explain the path to achieve all of these areas. So the burden of NCDs and mental health conditions is absolutely enormous, but so is our power to act. There's a cost to inaction. Every policy counts, every prevention program matters, and we must therefore scale up our efforts, ensure equitable access to care, and push for investments that reflect the seriousness of the challenge, but we can overcome if we work together.
Yes, indeed. And so we have a lot of good things coming up. That's going to be on September the 25th in New York City at the UN, at the high-level meeting on NCDs, looking for greater political leadership on NCDs and a focus and call for action on tobacco control, hypertension control, and mental health care. Thank you, Dr. Hennis. Thank you so much for sharing your insights with us, and to our listeners, thank you for joining us. I really do hope that we've brought you new information and inspired you to act more on NCD prevention and control. And if today's episode resonated with you, please share it within your network. Please also visit the PAHO NCD webpage, where we have tremendous resources and data and policy briefs and information on how to prevent and control NCDs. And as Dr. Hennis says, together we can really turn the tide on NCDs and protect the well-being of future generations. So until next time, please stay informed, stay engaged, and stay healthy.